Yate Bene, Shike, Aroshidene, She Orlando Naka, Korea, and my excusing, Inchne, Tachini, Pashichi, in the Chini, Pashinelli, Kiani Dashiche. In the Navajo culture and custom, we usually introduce ourselves by our clans when we make our relations in that way. So I want to welcome everybody to the National Council of Early Indian Health. It's an honor and a privilege to introduce our tribal chairman and president of the Navajo Diné Nation, Mr. Shelly.
I'd like to say Yate, good morning to all of you. Came in late, 12 midnight. I thought my reservation was canceled. I was looking for someone out there to speak with in the street, and there was a lot of them. They had good, nice sleeping bag. I seen it one this morning, so I wasn't too sure, but my reservation stayed intact. So anyway, I'm glad to be here in the Washington, D.C. area, and also my brothers and sisters, all of you that are here, good morning to all of you, and the tribal members, and also the IHS people, and I'm very happy to be here. I usually start off by saying Hashanah, meaning that I love you all in Navajo. Hashanah, my mom and dad, Hashanah, my grandpa, my grandfather, Hashanah, my young people, my grandkids, and Hashanah, my leaders, Hashanah, the veterans that are all here. We thank you very much for all the things you do and service that you provided to protect the Navajo, the Indian Nation, and the Navajo Nation, and also the United States government. I am the water that flows together, Kanini. That's who I am. And my fathers are sagebrush people, Chai Skinnies. And my grandpa's a salt people. And also my cousins are Deerwater people, Topini. That's who I am. And distinguished guests, healthcare providers, federal official, Assistant Secretary of Indian Affairs, Mr. Akahawk. I don't see him here, I think he's here. Yate, and good morning. It is my honor to have the opportunity to address you all this morning. I have just held a series of town hall meetings on the Navajo Nation. It was a marathon for me. It was tiresome. It was a dialogue with my constituents. I took all my staff and division director on the road for 5 days to provide the 100-day report for the Shelly Jim administration and to receive feedback from the people. It was tiresome, but it was a lot of fun too. It was extremely important to me because I wanted to hear from the people what they want. What is their plan and concern? I do this and I will do it. I have done that. I planned a whole town hall meeting in the urban areas too, such as Phoenix, Albuquerque, Salt Lake City, Flagstaff in the near future. And I'm going to hear a lot. I know they have a lot of concern. And I'm hoping that I'm here to provide you some ideas as urban Indian healthcare providers. This has always been the problem. You know and I know it. I'll give you our status and our information from the Navajo Nation government side. But I will also issue a challenge in my report, in my statement, to all of us, each you and me. This morning I would like to talk about two issues. Number one, state Medicaid cut impact on off-reservation eligibility. As you know, it's all happening now. Number two, the Affordable Care Act as it relates to tribal membership in state insurance exchange. I'd like to provide a brief overview of the Navajo Nation to give you an idea of the scope of the challenge we face. Many of you know about the Navajo Nation statistic. The Navajo Nation is one of the largest federally recognized tribal nations in the United States. Our population trends about shows that we nearly double the sizes every 20 years. And this morning and yesterday, we had some more grandson that came. And every year, almost like every day or every couple of days, we have a members in our family showing up. The current total population far exceeds the 298,000 counts in the 2000 U.S. Census count. Of that number, a little more than half resides on the nation, and the remaining numbers reside in nearby border towns and in major cities across the United States. Last year, the Navajo healthcare system counted a little over 1 million outpatient visits, which is a population equal to some of the major urban areas in the United States. The Navajo healthcare systems include the Navajo Division of Health and Social Service. The Indian Health Service has 5 638 tribal organizations and an urban Indian program, such as the Native American for Community Action of Flagstaff, Arizona. The Navajo area Indian Health Service, one of the 12 area offices within the IHS, in conjunction with the 638 tribal organization, provides prime health care service to a 246,000 users population. In FY 2010, the Navajo area in the IHS counted more than 183.5 million revenue generated from the third-party payers such as Medicaid, Medicare, and private insurance. These funds provide significant support necessary for the local healthcare system to provide quality healthcare service to our people. Although modest increases were made to the IHS budget in FY 2009 and FY 2010, overall underfunding remains a major problem. Regarding state Medicaid cut impacting on and off reservation eligibility, it has been a year since the permanent reorganization of the Indian Health Care Improvement Act, which includes the Navajo Nation Medicaid feasibility study. The provision directs the federal government to conduct a study to determine the feasibility of treating the Navajo Nation as a state for the purpose of the Social Security Act and to provide service to American Indians living within the boundary of the Navajo Nation. We expect the study will determine that the Navajo Nation be designated as a single state for Medicaid and to receive direct funding from the federal government. The Navajo Nation has been requesting the Department of Health and Human Service, IHS, CMS, to fund these crucial studies. Throughout the country, states like Arizona are struggling with financial constraints and are targeting reduction in funding and service in Medicaid. These adverse impacts include American Indian and Alaska Native enrolled in the Medicaid program. In Arizona, approximately 50% of Native Americans are enrolled in the Medicaid program, of which nearly 50,000 are Navajo. The Navajo Nation continues to protect the Indian healthcare system, Medicaid, and state children health insurance program members through its advocacies by working with the state and federal government to continue these Medicaid eligibility program. 2, Affordable Care Act as it relates to tribal members in state insurance exchange. The Affordable Care Act includes some benefits that will only be available to American Indians who are enrolled with federal recognized tribes. These benefits are characteristic as waivers and exemptions in the new act. While enrolled into a federal recognized tribe varies among tribes, I would like to encourage the urban Indian program and Navajo people who live in urban areas to conduct Navajo Nation vital statistics about tribal enrollment process. The Urban Indian program can assist in reference for enrollment, referral for enrollment back to the Navajo Nation. Finally, I would like to mention that the Navajo Nation is closely monitoring the implementation of the Affordable Care Act and the Indian Health Care Improvement Act, just like many tribes. We continually requested the state within which we live to provide adequate tribal involvement before rolling out the state insurance exchange. The Navajo Division of Health and the Navajo Nation Washington, D.C. office remain involved. I encourage you to partner with federally recognized tribes to advocate for voting position of the state insurance exchange governing board. I believe there's some here. The governing board should include a voting position for tribal leaders and urban tribal members. The Navajo Nation has been approached by other Southwest tribes about the feasibility of partnering and regional tribal insurance exchange. And this concept requires further study. Let me also add, there's a conclusion to this, but again, I'd like to issue a challenge. The Navajo Nation has also challenged itself, and when I was on the TTAG, which I'm not, as a vice president, a year ago, when I was a vice president at that time for the Navajo Nation, I was a member of TTAG. We were fortunate enough to work on a citizenship, and President Obama signed it. And we always have a problem with our citizenship with states and our birth certificate. A lot of us Indians are my age. We are born at home, so we weren't born in the hospital, so we don't have a birth certificate. And I have run into states where they asked me to bring a witness to my birth. And most of my births are gone. The witness my birth, they're gone. So again, we're in this predicament. But we are a recognized tribe. I've been asking the United States Attorney General to recognize sovereign government, which is the Navajo Nation is a sovereign, all other nations are. They should recognize us, and so that we don't have to go to state to prove ourselves that we're citizens of the United States. It should be able to be proven that we are a sovereign government and we have census number and membership to the tribe. That should be sufficient enough to recognize as a sovereign government. And with that, we're also working on our identification card. Maybe that was some of the things we talked about in TTAG. A lot of our veterans and also our urban Indians are having problems getting health care. And I do know that we also know that states and off-reservation healthcare facilities are numbering Indians as included in their budget, meaning that I believe some of those are healthcare are saying that Indian tribes are being served, which is none of them. Maybe that's the question. But the proof had to be there, so identification card would be one of the new technology that we use to maybe develop our identification card and then go to these facilities. The numbers and data will be in order. Statistic will be there. How many Indian does get off reservation and get help in health care? That might be one of the solutions that we're trying to do. And the other one is I'm very worried about the Healthcare Reauthorization Act. We don't know if it's going to happen or it's being challenged now. So what if it didn't go? What if it happened or not? That's the question we need to work on. I understand it would probably be, if everything goes well, we'll be using that in 2014. I'm not sure on that, but that's what I hear. Again, these are things that we are working with for our urban Indians that gets off the reservation. I do know that they are in need of health care and they are very concerned. And as healthcare providers, I think we really need to work together and partner and show us what is the best way to work with each other at the border town and off reservation area. This is something I'm looking forward. I need some ideas. I'm willing to work with you. And what would be the solution? We need to resolve that solution for our urban Indians out there. Are we going to continue having this problem and complain? And again, thank you for allowing me to be here. And in closing, I would like to extend my deepest appreciation to all urban Indian healthcare providers for the quality healthcare you provide to our tribal members. And thank you, Akaha, and may the Lord bless you. One of the true things about Indian tribe and Indian leaders is that we have fundamental laws that are not written. When we do our prayer, we don't write it. We come from the heart. And that's how we pray. And thank you for allowing me to be here.